Thank you. So good morning, everyone. My name is Sara Dugan. I'm a mental health pharmacist and faculty member at NeoMed. Our topic for today's didactic is nutrition and metabolic impact. Our objectives, we're going to look at a couple different things. So first of all, laying the framework to define nutrition and metabolic impact. So what exactly do those terms mean? We're going to look at some of the attributes. So what are the components that go into nutrition and how do they impact overall functioning? To then look at a couple situations where changes in nutrition may actually impact the overall functioning of an individual. So starting with definitions. So nutrition, and these came just from dictionary.com. So nutrition being the process by which organisms take in and utilize food material. Most of the information related to nutrition really looks at nutritional choices, dietary selection, things like that, being able to compensate and make alterations based on different medical conditions, patients with diabetes, for example. So what type of nutritional choices do they need to make? But we're going to take it even a step further down to just look at the general components that go into nutrition and what is it that they do. Because if we zoom in a little bit closer, we'll see that this really impacts the entire way that our body functions. So it shouldn't be a surprise that when we make changes to our diet and our nutrition that we see changes in other areas. The second half of the topic is really focused on the metabolic impact. So looking at the sum of those physical and chemical processes. So how does everything play in together? So looking at that relationship, I really tried to focus on a couple examples of how nutrition may have an impact on medical conditions overall. So it's tough to see what our metabolism looks like, even though we're all metabolizing things right now. Whether you just ate lunch, you're doing so now behind your black screens, or you plan to do so afterward as your body breaks down all of the ingredients from what you have for lunch. It helps you as you're sitting here breathing and thinking and blinking and listening, all of those different pieces. But looking at it in a medical context to be able to see some symptoms a little bit more specifically versus just the day-to-day activities. So looking a little closer at nutrition. So food plays an essential role in growth and development. Growing, we see all of the growth curves for children and adolescents, trying to make sure that they're right on track. But in addition to building the body, nutrition also plays a huge role in maintenance. So I think weightlifting was what came to mind. My son is 14 and he just started going to weightlifting practices for basketball. And one of the things that they told them is really that what you're doing is as you're lifting weights, you may be damaging some of the muscle. It breaks down a little bit and then builds back a little bit stronger. So food plays an essential role in having the ingredients there to maintain, to really help the body continue to function normally, as well as to grow and build up if an individual is training for something or trying different activities. The other big responsibility that food plays is that it's fuel. It's the energy that goes into the tank to help the body take care of all of the things that it needs to do. And there are a ton of things that it does. We really could spend quite a bit of time on just one individual area. So we're going to try to be a little bit more broad, but thinking of it as fuel for the body overall. So in order to look at that, there are three categories of food that we're going to focus on. So carbohydrates, in this case, we're really going to focus on compounds that contain simple or complex sugars. So one sugar or multiple sugars, and it can come in a variety of different forms. Fats, so compounds that contain hydrocarbon chains. So chains that have a carbon and hydrogen atoms, they tend to be less water liking. They like much more of the fatty tissue. And then proteins being compounds that are made of amino acids. In general, for healthy diets, they do recommend, and this is just a generalization, a composition of 55% being carbohydrates, approximately 30% being proteins, and 15% being fats. And we're going to look at a couple different distributions of that, especially in one example a little later on. One of the reasons this is the distribution, the proteins will be needed to help build things up. The fats also needed to help build things up, but carbohydrates we're using really as fuel. So recognizing we need a little bit greater amount of those, but they come in lots of different shapes and sizes. So let's take a peek at some of those shapes and sizes. So for the carbohydrates, we have the simple and complex that we just talked about. So a single sugar versus a complex carbohydrate that may have multiple types of sugars. So this may take a little bit longer to be broken down. Cells will release that sugar right away. If you think of a patient with diabetes, if their sugar gets too low, we want to give them something with simple sugars, something like an orange juice. Why? Because the body doesn't have to do much to be able to use that fuel right away. Whereas an individual with diabetes who doesn't have low blood sugar and we're trying to keep their sugars low, we may really want to focus on increasing the amount of complex carbohydrates. So those that require a little bit more processing and aren't going to cause a huge spike in the sugar levels right away, we want the body to be able to use it over a longer period of time. Something like brown rice, wheat bread, whole grain bread, those would be examples of more of the complex carbohydrates. Other considerations is whether or not the carbohydrates are soluble versus insoluble. So soluble meaning that it can go out into fluid, the body can absorb it really well. Insoluble meaning it's not going to dissolve. So these are going to be the carbohydrates that'll stay right within the gastrointestinal tract. So what would we use these for? We talked about fuel and energy. For your neurons, those of you that are listening to me or maybe even multitasking right now, your neurons use sugars preferentially. That is their main source of energy. So they're going to be pulling whatever sugar we have in the blood at all times. Other parts of your body will use sugar if it's around. It can also use other types of fuel, which we'll look at in just a second. So those simple or complex insoluble are what helps us with that fuel. The insoluble really is essential as being the fiber in the gastrointestinal tract. So to help with patients who may be developing constipation. So having, instead of needing to treat, especially since some of our medicines are very constipating, instead of having to treat that with other medicines, increasing the amount, making sure there's a good amount of fiber in the diet can help keep the gastrointestinal tract healthy. And we're going to circle back to this a little bit at the end because there's more information coming out, because that seems like something we can push on the wayside, but it may play a bigger role than what we had anticipated. And then carbohydrates also can be substrates for enzyme activity. So enzymes are involved in a number of processes. They can be involved in the brain, in having your neurons fire so that you're recognizing and learning and maybe moving some of the things that I'm saying over into memory. They provide the fuel for those enzymes to be able to work, so all those steps in the process can occur. It also can play a role as fuel for enzymes in other parts of your body, releasing chemicals, releasing hormones, as well as allowing you to plan out and move your body around. So it really can be involved in a number of different places other than just being fuel. The next category being fats. So this is lipids or fats. And this is a relatively large class. They really are starting to break this down. Originally, this class was looked on as a bad class. And then it was, well, maybe there's good and bad fats. And now we're recognizing, oh, there's a whole lot of them. And we need to dig down into exactly what all of these are doing, because they can be really beneficial in some instances and others may not be helpful in, for some individuals. So what do the fats do? What is their purpose, their role? They store energy. So if we're eating a higher fat diet, if it's more than what our body actually needs in the energy category, the body can take that and store it, save it for a time that we may need it. The fats and lipids make up the cell membrane. So essentially the skin, if you will, of the cell, what protects the cell, the inside from the outside, and all those substances there. Lipids and fats also can surround and protect vital organs. It can help cushion them, keep them protected. Obviously, there is a fine line and balance there. We don't want too much of the fat growing around some of the tissue, but a little bit helps make sure that that's cushioned and protected. And then also the fat can accumulate underneath the skin, and that can assist with thermal insulation. So making sure that bodies are staying warm. So part of it is normal functions of the body, keeping the body healthy, keeping it warm, protecting the organs inside, serving as fuel, especially if we run out of our sugars, and then being actually part of the cells themselves. And our last category being proteins. So proteins are chains of amino acids. So the amino acids being here at the top is the one little circle. There's 20 different essential amino acids. 10 of them the body can make themselves, and 10 of them we need to get from dietary sources. And there's a whole bunch of different combinations, as you can see from the different colored circles there. Just trying to depict, we use quite a few of these, and they can be folded up in a whole bunch of different manners. The purposes of proteins, they help with the structure. So I think a lot of people will think of proteins when they think of muscle, when they think of hair. But proteins also make up enzymes and receptors. They're what make up the hormones that help send signals throughout the body. They make up the antibodies, so the chemicals within our body that help us fight off infection. And proteins can serve as a fuel and energy source. So they really can be used in a number of different ways as well. And for our visual folks, so this is the picture of a cell membrane here at the top on the left-hand side. These little red circles, so these would be made up of different fats. So that's really the membrane that's there. And then all of the blue membranes, some are channels, some are proteins, some are enzymes, some are receptors. These tend to be made up of a combination of proteins and sometimes some of the carbohydrates. So it can be vital ingredients and building blocks within all of your cells. And it helps us do all of the things down here in the picture that we need to do throughout the day. So keeping that in mind, we really are what we eat. So what we take in becomes part of us. Food choices are influenced by a whole number of different things. So individual preference, not everybody likes the same things. My son has a peanut butter and jelly sandwich every day. My daughter gags at the smell of peanut butter. So there is quite a bit of variability in individual preferences for what we eat. It's also based on what's available. So individuals who may live on an island or closer to the water may have increased availability of different types of foods like seafood. That might be a bigger part of their diet than someone who lives inland and maybe doesn't have exposure to that. Cost can play a huge role. That's why I pulled the little caviar picture here. So there may be some foods that are much more expensive in some places than others. I found it interesting as I was doing research for this talk that in the past, salmon and oysters had been relatively inexpensive. So in Europe, those were the foods that were eaten by individuals of lower socioeconomic status, and different proteins such as chicken and turkey, much more expensive, and they were not something that was eaten by the lower socioeconomic status class. And that has definitely shifted over time, where now oysters are much more expensive. So maybe they'd be associated with a different socioeconomic status. So that could even change over time. Religious practices. So there are some religions. So I pulled the kosher seal as well as the halal seal for Jewish and Muslim customs, where they're really looking for clean type foods. So that may dictate some of the food choices. Personal values, if an individual has very strong feelings regarding animals, for example, and treatment of animals, that may encourage them to eat more of a vegetarian or a vegan diet, as well as regional differences. There may be some food products, I pulled a picture of the haggis down here, which may be very popular in places like Scotland, but may not necessarily translate to other places. So it's not just that, yes, it is what we eat, but it's dictated by a number of different things. So does this make a difference? Well, we have a couple situations to consider. How might nutrition play a role? I think one of the ways most individuals think about nutrition and the metabolic impact is in relation to weight. So thinking about nutritional choices, I found it a little disappointing that when you pull up pictures of nutrition, it's just a good and bad picture. So it's either all fruits and veggies and whole grains, like what's over here on the left-hand side. And then there's pictures of bad. So everything fried and processed and things like that. A lot of the nutrition literature is starting to look at what's the way to balance both of them and not just put them in one category or the other. So while this is definitely a consideration and really drives a number of different medical conditions, that's not the only one. So let's look at a couple other examples. So the first one I wanted to look at was food intolerances. So celiac disease, the prevalence of celiac disease has gone up significantly over the last couple decades. So it is an autoimmune disorder, and it's a disorder that can be recognized in children, but in some cases it's not recognized until much later on. If we look at the symptoms, so the body may have a trigger, so they may have had an infection or some type of stress on the body, and then the body starts to recognize gliadin, so a component of gluten that's found in a number of grain type products. And it activates a whole immune response where it not only attacks some of the gluten, it attacks the lining of the GI tract, and it can cause inflammation and impact in other body systems. So as you can see from some of the systems of that are the symptoms that are listed here, patients can experience GI symptoms, abdominal pain, constipation, diarrhea, loss of appetite, but they can have a whole host of other symptoms as well. Anemia, fatigue, anxiety, depression. It's thought, and there have been a couple correlation studies looking at psychosis, so schizophrenia. There's a number of patients who have been non-responsive to antipsychotics, but when they've been tested and moved to a gluten-free diet, they've actually seen some improvement in their psychotic symptoms. So not just taking my word for it, but could this play a role? So what the individual's eating, might this be dictating some of the anxiety and depression symptoms? So this was a survey that was done in 73 patients, children 1 to 18 that had celiac disease. So they were being treated in a celiac disease multidisciplinary clinic. And they asked their parents to fill out a survey. So this survey was just asking about other medical conditions, mental health conditions, and psychosocial distress. And they did find, so the blue bar here are the patients with celiac disease, the percent of patients with celiac disease. The red bar is the national prevalence for individuals of the same age. What they found was there were significantly more higher prevalence of anxiety and ADHD in kids that had celiac disease than in the national sample. So we're seeing more of these symptoms. Now, is it because they had it? Is there some other type of relationship? But just something to think about. If we have individuals who have anxiety, ADHD, maybe even depression, and they're not responding to traditional treatments, might this be something different? This isn't the only example, and I wanted to give balance. So trying to think of a way that diet may be positive other than just with weight loss. A good example is ketogenic diets and epilepsy. So diets that shift metabolism from glucose, as you remember, I said about 55% of the diet is recommended to be carbohydrates. If we increase the percentage so that there is a significantly greater percentage of fats and proteins being ingested and less of the carbohydrates, then the body starts to use the fats. It processes them in fatty acids and starts to produce ketones. This actually has been shown to help stabilize some of the neuronal activity. And by doing that, it has had an impact on a number of different conditions, but epilepsy being a big one. There are a number of different trials that look at this. This was just one that I selected. So it was kids who had failed at least 2 trials of anti-epileptic medications. So they had epilepsy, they had been tried on drug treatment. We know that at least 1/3 of individuals do not respond to medications when they have epilepsy. So these kids were changed to a ketogenic diet. Only about 47% of them were able to maintain on this for a year. So we're going to come back to this in just a sec. Generally, it was well tolerated. There were some adverse effects from the diet, which I included here. But what they found is that 43% of the kids that were moved to the ketogenic diet actually became seizure-free. So their seizure frequency reduced to 0 when they looked over a 2-month monitoring period of time. 39% had their seizures controlled between 50 and 90% compared to the frequency at baseline. So a really significant, more than half of the seizure frequency that they had had previously. And then there were 17% that had no response whatsoever. So in this case, by having kids eat a ketogenic diet, start to have the ketones present, they actually were able to demonstrate that this benefited their epilepsy more so than any of the pharmacotherapy that we could have. Generally, it was well tolerated, but only about half of the individuals were able to stay on this diet. And that's consistent. It's right around 50% for a number of the other ketogenic trials that have happened. So knowing that if there are changes in the diet, that is something that we should keep in mind. Based on what an individual is taking in, that may give them much more energy so they're able to engage in other activities. Maybe they'd like to play soccer or to run track, but they just kind of feel sluggish and they aren't able to do so. If they make some dietary changes, that may change for them. We may see differences in medical symptoms. The types of foods that we eat actually can support the microbiome. So all of the bacteria that live in your gut, and those are being connected more and more to both medical conditions as well as mental health conditions. So they may be playing maybe an indirect step in the etiology of a number of these other conditions. So things to think about if someone's changing their diet, if they're changing locations, maybe there's a different person who's cooking for them. Maybe they were living with mom and grandparents moved in and maybe now grandma's cooking. Or if there are just other changes that they've decided to make for the diet, we do want to keep that in mind and watch for some of those other symptoms because they could definitely play a role. So nutrition plays an essential role in the growth and development, as well as the fuel for the body. And those changes in diet and nutrition could have either a beneficial or potentially a detrimental effect. So we want to make sure that we don't dismiss them. With that, I will stop sharing and turn it back over, Renee.
Great, thanks, Sarah. That was excellent. Appreciate that.